The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Kyle undergoes surgery, and Calla's struggle with cancer continues. 15-month-old Calla Dumichel has cancer tumors on both her kidneys. She was being treated with chemotherapy when doctors decided to try to remove the tumors surgically.
Everything she's had in her whole life has been so rare, and if they say there's a small margin, she just seems to keep falling in it.
You gotta believe in miracles. Miracles happen. The last thing you want to do is give up.
Oh,
So,
I know that.
we'll do the best we can. And she's a little fighter. She'll pull through.
Okay, we're in business. Let's go. And then there's the big tumor, occupies most of the kidney. Now, I think that kidney has to go. Let's go ahead and take that out.
Surgeons have had to remove the entire right kidney, but hope to save most of the remaining kidney.
Keep your fingers crossed. The area in the back part of the kidney that looked abnormal on the MRI, and it doesn't feel abnormal. Is it possible to get ultrasound to come and give us a hand here? What I'd like you to do is try and define for us the borders of that area in the front wall that represents the tumor.
There's the tumor there.
Yeah. Anything below that is clear? Well, that's good news for her. So if we go 2.5 by 2.5, we should have a good safety margin all around.
Absolutely.
I hope we can save most of that kidney.
Six-year-old Kyle has traveled with his mother to Toronto from Quebec, where his family lives on a dairy farm.
A little chilly, eh?
He was born with a malformation on his lip and cheek.
You need to go up one more.
Today, Kyle will have a procedure to block the blood supply to his lip. He will then undergo surgery to correct the malformation.
Did you have anything to eat or drink this morning?
No, I didn't eat anything. I didn't
Good
drink
boy.
anything.
Okay, so we'll give you a drink through your vein when you get in there. Give me a big breath. Come on. I see that smile. Okay, I'm just gonna listen to you breathe. Good fella. Do you have brothers and sisters?
Only brother.
Does your mom not have any girls?
No.
No. All the boys.
Hi, Kyle. Can you come over here for a second, Kyle? Let's just have a quick look. Come over this way. Good.
Cooperation, remember?
Same size as before, right? Okay.
I thought
You can
it'd
go
be
play now.
same. What could or what would happen to him if nothing was done, if he was just left to live his life with his lip malformed like this?
I'm not sure if Kyle is self-conscious about it now, but he probably will become self-conscious about it as he grows older.
And that's just what I was thinking of. Like I have 2 teenagers at home now. The girls are getting very popular at my house now. I see what my older sons are having, and I didn't want Kyle to miss out on that. That's such an important part of life, like that first kiss and everything else.
These are some of the films from the last angiogram I did. As you can see, the blood supply is quite rich, or quite intense.
Yeah.
And what I want to do is to take away that blood supply. It's a pre-surgical treatment to decrease the blood supply to the malformation so that the surgical reduction of the lip can be much more easy. I expect that the cosmetic improvement will be quite significant.
Okay.
Okay?
Yeah.
Any other questions that you thought of?
No.
This is our room.
He's been in the sleepyhead room before.
You've been in our room before.
Where can I put my...
It's great.
Yeah.
And you have to go out the door. That's great. Marlene's going to show you out. Good care of him.
Okay, thanks. That was really great.
Do you want the spot on you or the rest of the
I don't
lights
mind.
off, the spot on me?
Yeah, the spot is good where it is.
After all that?
Okay, this is the left external carotid. You go lateral, please.
Okay, I need to send this up to pathology, please. I need them to look at the margins. So we're in good shape with this girl, I hope. As long as her kidney doesn't form more tumors on us, we should be in great shape. All right, I'll go talk to her.
To the ICU.
Well, we're all done. Things went well. They're just waking her up now, and she's breathing on her own, so things went really well. The right kidney didn't look like we could remove enough tumor and leave enough kidney functioning tissue that would make it worth her while. So we ended up removing the right kidney completely. And then we went over to the left side. We defined together what part of the kidney needs to come out, and then removed that front wall of the kidney.
Her kidney that she does has, it's the same size as it was before. It's just
Missing the front
the
wall.
front part of it.
Right.
Okay. And it should function normally, you're hoping, and
It should. There's a chance that it will leak some urine where that raw surface is. But otherwise it should, yeah. She should have good function from that remaining part.
so now she'll be able to finish her chemo treatment. And
Well, I'd like to wait a few days. I mean, we're not going to jump in. We'd like to give her a chance to heal a bit. It'd be hard to start chemotherapy if the kidney's not functioning well. And then we'll take it, as it comes after that.
yeah, it's been a day by day.
Yeah.
road
All right.
with Calla. Thank you so much.
We'll be fine.
Thank you.
Okay, guys. Take care.
Thanks.
It's good, Emma.
It's still not over. She's fought this now. We can fight the cancer. Has she woke up at all, or is she still?
Yeah, she's cried a little bit.
Oh, has she?
She doesn't open her eyes though.
No. Oh, sweetie, mommy's here. I just want to see what they did to her. It's in there.
So it goes across here. She's a drain here. And a cup here.
Calla.
Oh, baby girl. So strong.
Hey, you gonna wake up for Daddy? Hey?
Kyle's mommy, do you want to come in?
Yes, yes, I do.
We called for mommy.
Kyle. Kyle. Hi, Mom's here. Can you hear me? Want to have a little sleep? Okay, I let you sleep, okay? Okay.
So how are you guys doing?
Hi, Dr. Phillips. How are you?
Yeah, I talked to Dr. Armstrong, and he was very happy that he was able to knock off the main arterial blood supply to this, so that if we do surgery tomorrow, the risk of bleeding is much, much lower. We'll err on the side of caution in terms of how much we'll take out to avoid any injury to the nerves or the muscles to his face.
This is what we've been waiting a long time for, eh, Kyle?
I don't want to do it like that.
No? Well, how do you want to do it?
I want to go home.
You trust Mommy to do what's best for you?
No.
Kyle, you do too. You do too.
You're my pretty patootie.
I like that. She's got her eyes open.
Sweet girl. I've been through so much.
How are you?
Yeah, good, fine.
You have a good night?
Yes.
Yeah.
Exhausted and relieved that she got that. Still got a kidney in her.
She's done very well overnight. Kidneys continue to make good urine, fortunately. I'm very happy about that. And it looks nice and clear, nicely dilute, so hopefully.
You're just like my miracle that I prayed for
It
when
is.
you were
It
operating
is.
on her, because we
It is.
just didn't know what to think, and it was so scary. And
So we're in good shape. I think we're in good shape.
Yeah, there's a bathroom downstairs, remember? Don't throw Sam. Sam didn't do anything wrong. Watch it.
Kyle, you're gonna get a little sleepy, okay? Mom's gonna stay with you.
Do you want to play that game?
Okay, so let's see if we can lie him down.
Go just lie you down, okay, Kyle?
Okay.
Okay.
It's okay.
Here's your monkey.
Mom's here. It's just
Here's your
mom.
monkey.
It's just mom. It's just mom.
Okay.
Okay, we're gonna take a minute.
Okay, all right. Look good care of it, okay?
Here we go.
Yeah. Oh, he's so scared. He's so
Can we walk you out? Oh, he's gonna be fine, really. What we'll do is we'll come out. I'll come out as soon as we're done.
Well, we've got some urine leaking out of the drain, which is not unexpected. That's okay. I mean, it's once you cut across the kidney in that way, you've got the kidney's like a little sponge, and you've got so many little holes in it, and it's impossible to seal them all off. So then what I'd like to do is just put a stent up in that, through the bladder up into the kidney without surgery, just with the scope, so that we divert the urine and encourage it to come down through the catheter that's in the bladder. And the sooner we can get her urine diverted out, the faster she'll heal and get back on her chemo, etc.
Yeah, okay, that's the most important thing.
Yeah, very good. Okay.
Thank you.
All right.
Okay, bye, Mom. Take care of her. Yeah, they will.
We're going to have a shot. You see the inferior calyces?
Yeah, there it is. And there's your leak.
Superior calyces?
Yep.
Let's push it more. Yeah, that's perfect. So, everything went perfectly.
Okay.
So we put you see here, we put the catheter inside.
And how long will this be left in her?
This we will keep it
For a bit?
at least nearly 3 to 4 weeks. When that drain here will start to give less urine, we're going to remove it.
Is that going to hurt her?
No, this not really. She'll be happier without it. I think it will be really perfect.
Yeah, well, that's great.
I hope so. Okay, bye-bye.
Bye. Have they given anything for discomfort or?
Yeah, she had a Tylenol, and she had something in the ER.
She looks so pale.
She does look pale.
I was just wondering what her counts were because looking pale's not good, Calla.
No, what we're doing is we try to identify normal anatomy. In this case, you really want to preserve his muscle that allows him to open and close his mouth. It's not as vascular as we would have expected. And obviously it's because Dr. Armstrong yesterday did a good job in embolizing it. It's really starting to swell.
Yeah. It's looking good though.
Went well?
I hope, despite some swelling you see now, you're going to see a nice change. You'll get a general idea of contour.
Oh, I'm anxious to see him.
And, but unfortunately, overnight, he's really going to swell.
Yeah.
There's no question. And then hopefully over the next, probably by about 3 to 5 days, swelling will start to go down. And as you said, it'll be over the next couple months, we'll start to see the real change. But I think it's going to be worthwhile.
Thank you very much.
You're welcome. All right, we'll see you later.
Okay.
Hey, somebody's hiding their face. How are you? I think I'm happy with how things have come along.
Good.
Yeah. So we're going to take the drain out now. Yeah. And from a surgical standpoint, I think we'll be done.
Done?
Yeah.
Oh.
Yeah.
So that's great then.
Hey.
Oh, thank you.
Fine.
That's great then.
All right.
Thanks.
Good.
I don't know how long it's gonna be, but this part's all gonna be flat. Yeah. Okay,
Oh my God. Jeez. Hi, Kyle. Mom's here. It's okay. It's okay. Mom's here, okay? Yeah. He was so terrified.
Was he?
Poor guy. Yeah. Oh, I gotta get out of me.
I'll get you a chair.
No, it's okay.
You okay?
Just,
You sure?
yeah. Kyle, you know it's all over now, eh? Okay. And you feel good about it? Good. Good.
Is he swelling up?
Yeah, he's swollen, yeah.
Oh yeah, he's really going up.
After 6 years of seeing that lip out, the first thing I said, oh my God, I had to get on my knees. I thought I was gonna drop.
Yeah, it's
the
gone.
lip is gone.
Yeah, it's going to be amazing, I think.
Yeah?
I'm hoping, yeah.
Okay.
We'll see you tomorrow.
Okay, thanks.
Hello. How are you?
Good. Impatient.
Impatient for what?
Well, just nervous to hear what's happening.
Well, it's pretty good. The right kidney. This thing that had grown, it's not clear why it had grown because there's very little tumor in it. This was not a growing tumor.
Great. Oh, that's so good. And while she's on chemo, no more going to come on that one kidney that's left, eh?
It shouldn't. Now, you know, can I write you a guarantee? No.
No. I know that's the one.
But I think that with the addition of a more powerful, more stronger chemotherapy, the chances of it recurring are very small.
So you'll get in touch with me when everything starts? And...
Yeah, we'll just keep track of what's going on. So
that's good.
We'll keep in touch.
Okay, thanks. Thank you. No faking though, take a real drink. Oh, that's it? Oh,
You're too smiley. You're just too smiley.
I think that's the most you drank in one day, Calla.
At least she's got the glasses to protect her eyes from the straw.
You're a funny girl. You're a funny girl. Does she get the, what's it called, ventricular first?
Yeah. So what I'll do is I'll push some fluid through, and then I'll push the medicine in, and then push some more fluid through to make sure it gets to her. Big yawn.
Will you sleep on us?
It's gonna be over before you know it.
Do you remember where the clinic is?
So, what do you think? You think it was worth going through all that?
The girls think so. Adian sure likes it. Hey?
Let's take a peek at you. Can I touch it a bit? Not gonna hurt you, okay?
Now, is that still swelling?
Yeah, he's
or-
still got a little
Yeah.
swelling. But I think he's made a nice change. I really.
Oh, I think it's a great change.
Kyle's surgery has been a success. He will be seen by doctors in 6 months to determine if additional work can be done to further reduce the malformation in his cheek. But Kyle is very pleased with the change in his appearance.
Calla, sit down.
down. She's doing very well, aren't you, Calla? What are you up to? You're going to fall. I think maybe you should get out of that before you fall. You see, she's feeling better, definitely.
Oh, yeah?
Yeah.
We're going to be going Friday. We still get to go home Friday.
All right.
So she's all done now for blood work. And
yeah, she's had some bloods this morning. There's no need to do any bloods tomorrow. She can go home.
oh, very nice girl. Give Daddy a kiss now. Oh, she wants to give you a kiss. Oh, your mom's girl. You're giving me a kiss.
After a month-long stay, Calla is ready to leave the hospital. She will continue chemotherapy treatments at a hospital in Sudbury, near her home.
Bye. Thanks for everything.
Doctors are hopeful that her future looks positive. On the next episode of Life's Little Miracles, Chris faces cancer, and Eric gets a smile.